So today I'm going to show you guys what we do during a prenatal visit. A very important test that everyone don't really know what it's about is the urine dip. So this is a urine sample. It's actually mine. So we'll test to see if there's any glucose or protein. So when we do a urine dip, this is the test strip that we use. And there's actually two components that we look at. One is for the protein and one's for the glucose. And this test strip actually, if you look closely, it gives us a reference as to the color change. So basically the top is the protein and the bottom is the glucose. And so I'm gonna dip it and it's gonna change color. But the important thing is for protein, you wanna wait for 60 seconds and for glucose, 30 seconds. And so if you don't give it enough time, you may not be making an accurate analysis of your urine sample. So we just take this and we dip it in the sample. And you don't really need to keep it in that long, and then you just hold it there. And then we wait for 30 seconds to look at the glucose. So now it's been 30 seconds, and so I'm gonna look at the bottom one to see what is the color that it's closer to. And it looks really much like our reference, which is negative. So I'm calling the glucose negative. So I don't have glucose in my urine. At least I don't think I'm diabetic. That's not the way to screen, but then if you have a very high glucose level, then you gotta be a little bit careful. What you ate just earlier is gonna affect it. If you just had a big piece of brownie or a chocolate ice cream, that's gonna go high. So now it's been another 30 seconds, so we look at the protein. So the protein, I would say I'm kind of between a negative to maybe a trace right there. And that plus and minus sign, it means trace. So the next one is 1 plus, the second one is 2 plus, and then 3 plus and 4 plus. So that's it. That's how we test your urine for protein and glucose. And we're gonna make another video about what's the importance of these testing. But thank you for watching. Any questions, please let us know.